Hello and welcome everybody to the Duke Caregiver Community event. We are here today to talk to you about how physical therapy, occupational therapy, and speech therapy can help both the patient and the caregiver to age in place. My name is Matthew Hyde. I've been a physical therapist for 28 years, at least 20 of which has been spent in the home environment, mostly in home health. And my colleague Latoya Galberth will be taking over for the second half of this presentation. One of the things I love about working in home health and in people's homes is getting to see the actual true environment that they are in. You don't get this type of experience working just in hospitals, and I think it gives us a unique perspective on how we can help the elderly and caregivers to function and maintain a very good quality of life in the home. So our objectives today are to, number one, discuss how physical therapy, occupational therapy, and speech therapy can help both the patient and the caregiver. We may abbreviate these things as PT for physical therapy, OT for occupational therapy, and ST for speech therapy. The second objective we have today is to help you understand and promote aging in place. Aging in place will be defined later, but essentially it means keeping you at home, which is what we all want to do. And then thirdly, we will be discussing how and when to ask for help. So how do you raise the white flag, ask for assistance? What does aging in place mean? The CDC defines aging in place as the ability of one to remain comfortably, safely, and independent in the home and the community. And that's really important, in the community, regardless of age, income, or physical abilities. So aging in place, essentially, what that refers to is keeping people home in the place that they enjoy with the people they love, doing the things that they love. That can be a challenge as we get older. We know that we have some changes maybe in cognition, in our physical abilities, and in our support system, because oftentimes the caregiver is of the age of the patient or maybe an adult child with limited time resources. So we want to make sure that we understand what aging in place is and how we can keep people home and comfortable in their environments. So how do we best age in place? Well, first, the two things that we want to keep in mind is are being safe and being comfortable in the home. And being comfortable means having a quality of life and activity level that promotes continued health promotion. So in order to remain safe, we need to make sure that we're, number one, taking our medications or discussing with our physician what medications we maybe have difficulty acquiring or difficulty taking, what that we don't tolerate. So we need to take our medications appropriately. We need to make sure that we have appropriate transportation, whether you drive yourself or you may need to, as we get older, acquire a different means of transportation. Maybe it's public transportation or asking family for help. Thirdly, we want to make sure that we adapt the home to our current abilities, which may change over time. And lastly, we want to make sure that we prevent falls. So what can physical therapy or the physical therapist do in the home environment to help me age in place? Physical therapists typically see conditions such as stroke, Parkinson's disease, multiple sclerosis, spinal cord injury, and other neurological conditions. We also treat patients with orthopedic or bone and muscle conditions such as fractures or broken bones, joint replacements, arthritis, and other conditions. And oftentimes there is a component in illness of cognitive changes. So we see patients with dementia and Alzheimer's. What does the physical therapist do in the home? The physical therapist with the patient will do things like work on balance, strengthening, endurance, getting out of bed, up and down from a chair, which we refer to as transferring, and gait training, which is walking. We also do things like help manage pain and promote activity and fall prevention in the home. So the crux of this conversation is, what can the physical therapist do to help the caregiver? The physical therapist can help prescribe and instruct and educate in the use of equipment to make getting out of bed, getting up and down from a chair, and walking easier on all surfaces. This may be something as simple as a hospital bed or a bed rail. It might be something like a mechanical lift to help you, the caregiver, lift the patient. One of those devices is called a Hoyer lift. And we also work on helping people walk in a way that's safe. And if you can't walk, we want to make sure that the patient can still get around. So sometimes people use things like a cane in the home, maybe a walker to get out of the home, and they might use a wheelchair or a motorized wheelchair to go longer distances or in order to better interact with their environment. The physical therapist may also help by making some recommendations for home modifications. Some of the common home modifications could be as simple as removing a throw rug or making a walkway easier to access by removing some clutter. It could also be something a little more complicated, like having a stair glide installed. A stair glide would take you from the first floor of the home to the second floor of the home and eliminate the need for to climb stairs. It's amazing what a handrail or two can do on the stairs as well to make going up and down stairs less challenging. So it could be something as simple as moving a throw rug or something as complicated as making a home renovation or installing a ramp to enter and exit the home. The physical therapist may also work with you, the caregiver, to make sure that you can handle your loved one effectively and safely to avoid injuring yourself or the patient. We do this by possibly showing you physical techniques. How to handle another person can sometimes be a challenge. We don't want to pull on an arm or injure the other person. We also don't want to injure our back. So there are correct ways to do lifting and assist someone with rolling in bed, and also allowing them to be as independent and functional as possible and contribute to the activity. The more we contribute to the activity, the more likely we are to maintain our health and our functional abilities. So before I hand off to my colleague Latoya, I'd just like to mention lastly about how fall prevention is so important. Fall prevention can take a lot of different avenues. Sometimes fall prevention means not walking and using a wheelchair or using a walker when you don't have a caregiver present. Sometimes preventing falls can be something like taking your medications at the correct time to prevent dizziness, which sometimes happens when people get up out of a chair. Preventing a fall can also mean maybe setting up kind of a nest arrangement where maybe your bed or hospital bed is right next to a wheelchair. Maybe the wheelchair is at the foot of the bed and the commode is at the head of the bed. And at nighttime or when no one is available to assist, maybe that type of nest setup can help maintain independence and prevent caregiver injury and patient injury. So now I'm going to hand off to my colleague Latoya.
Thank you so much for that information, Matt. Hi, everyone. I am Latoya Galberth, occupational therapist by trade, as well as certified dementia practitioner. I am also the owner and rehab director of Galberth Health, which is an in-home therapy company that specializes in dementia care. I've worked exclusively in senior care for 12 and a half years now, so needless to say, I absolutely love what I do and consider myself very lucky to do it in connection with other wonderful clinicians such as Mr. Matthew Hyde. So, most of you are probably pretty familiar with the common grouping of PT and OT. So I'm here to set the record straight. OT does not stand for other therapy. Occupational therapy. And we help our patients develop and recover the skills that are needed for day-to-day living. So our emphasis is on what it is that you need to do. Emphasis on do, because we know that for you as the caregiver, these tasks will begin to change over time as your loved one ages or as their condition or diagnosis worsens. So you need to make sure that you have the tools equipped to be able to continue to have them perform these tasks in several capacities. So this is where we as the OT will come into the home with the skills, the knowledge, and the training to equip you with what's needed to be successful in bathing, dressing, grooming, toileting, transferring, feeding, even ways to conserve energy, as well as your ability to participate in social and leisure tasks. And that can range from going out to a community outing or a weekly bingo. And then again, because we are huge advocates for aging in place, we also want to ensure that we're able to create an environment for you and your loved one to be successful in doing so. So how can occupational therapy help the caregiver? One of the things that we can do is educate and train our caregivers on new habits and routines for safety and day-to-day living. And we can go about this in several ways. Just think, for instance, how much more efficient a dressing task could be if you were to initiate that process for your loved one the night before by pre-fastening buttons on blouses, or if you were able to schedule a shower for a time of day in which your loved one had the most energy or your loved one was the least confused. And we can also recommend equipment that would decrease this burden for you. And this equipment can range from adaptive utensils to even a Hoyer lift if needed. So just think about, again, how much more efficient a mealtime could be if your loved one was prescribed an adaptive fork or spoon because they had rheumatoid arthritis and this process was very challenging for them and you had to do the bulk of the work. So now they're more efficient and independent and you have an additional 30 to 45 minutes of your day that's still intact and can be devoted to other tasks. And then we can also provide and teach you strategies to assist with some of those transfers and, again, self-care tasks. Just think of how much less stressful, I guess I should say, it would be if you didn't have to call your neighbors over to help you transfer mom or dad out of your bed and into their favorite recliner, because now you have not only the proper equipment, but the strategies needed to do so. And we can also assist with home safety. And again, I know that beautiful throw rug may work well for you and your decor, but probably not so much for mom or dad if they're constantly tripping over or falling on it. And then also consider the benefit of a bed cane if mom or dad is having a difficult time transferring in and out of bed, or raising the height of the toilet seat, or including a shower bench in the bathroom, or adding additional grab bars. So these are all ways that we as the OT can assist making sure that your home is safe. And then we can also introduce new approaches to self-care, because sometimes it's not always about the equipment, but the approach. What's not working? Why? How can we make those changes? Can we change what we do? Can we change what we say or how we say it? Can we make the environment warmer or brighter, less chaotic or less confusing? And then we can also help you and your loved one identify and explore hobbies and activities of interest, because we know that it's not always about what you need to do, but what you want to do. And again, this can range from going out to restaurants, participating in weekly bingo, or even just spending time with your grandkids. And for you as the caregiver, it could simply be taking a step back from the primary caretaker role and just being the son, just being the daughter, or the husband or wife. Now, how can OT help the caregiver manage dementia? With dementia, a hot topic is usually behaviors. So with that, our OTs can come into the home, help you identify and address some of those triggers for behavior management. So why is mom lashing out during those showers? Why is a task that dad used to enjoy now making him so angry? Why is your loved one resisting being transferred from one space to another? So again, we can help you not only identify those triggers, but figure out ways in which we can decrease those. and then preventing what we call excess disability. And essentially, this is when you, as the caregiver, have the tendency to overdo it. So you say you want to do it all for mom or dad. So essentially, we will come in, talk with you a little more about their cognitive ability, and then provide tasks that are appropriate so that they can function according to where they are in terms of their memory and cognition. Now on to speech therapy. Whenever we make recommendations for speech therapy to our patients or our families, we'll usually get the response of, well, there's nothing wrong with my speech. I can talk just fine. So just know that speech therapy encompasses so much more, and they're able to address difficulties with swallowing, challenges with speech, obviously, language expression and comprehension, even reading and writing if that's the primary means of communication, and then memory and cognitive training. And this is one of the bigger focus areas for speech therapists in senior care, along with those challenges with swallowing. So common conditions that speech therapy address are related to CVA and stroke, other neurological conditions that we've mentioned before, such as Parkinson's, dementia, and Alzheimer's, respiratory diseases, any impairments of the head or neck that may also affect communication, as well as your memory disorders. So how can speech therapy help when there are communication problems? So we all know that communication is a two-way street, and usually a breakdown in this area can also lead to breakdowns in other areas as well. So the speech therapist will come into the home and teach you strategies for better understanding and comprehension. Because as the caregiver, how important is it for you to be able to understand the needs of your loved one? Very, right? So again, the speech therapist will train you on different devices or other options such as using a communication board to help you be more successful in giving and receiving information. The speech therapist can also help the caregiver when there are swallowing problems. And this is probably something that you typically wouldn't think about or consider. But just reflect back to the last time that you sat down with your loved one for a meal. Did you notice that there was a lot of coughing involved? Or did you notice that they were shoveling food in their mouth? So the speech therapist can come in and assess whether or not there are swallowing difficulties by making recommendations for the appropriate food items as well as the consistency. So that could be that they are appropriate for some of the food items that they were served, or that it may need to be modified and now they're more appropriate for pureed. And then the speech therapist will also ensure that they're able to integrate their likes and dislikes so that you as the caregiver don't have to reinvent the wheel. And then they will also educate you as the caregiver on different swallowing techniques and hazards to lower the risk for choking, such as slowing the pace when they're eating, as well as taking small sips of water in between bites to prevent pocketing in their cheeks. Again, ways in which you want to not only make the mealtime experience tolerable, but one that's efficient and enjoyable for the both of you as well. So how can the caregiver, or how can the speech therapy help the caregiver when there are memory or cognitive problems? So the speech therapist can come into the home with a variety of tests to decide where those greater problems lie. Is it with short-term memory, long-term memory, or problem solving? And then they can work with you on assigning tasks that are appropriate for your loved one. So it's not a matter of just pulling out a photo album from 10 years ago and quizzing mom or dad on family members or asking them to name all of the kids from Great Aunt Linda, but actually assigning tasks that are appropriate so you're not asking your loved one to perform above or below their cognitive level. So when should you ask for help? We've discussed the who, the what, and the how. We've talked about who we are, how we can help. Now we want to discuss When. I'm always inclined to say that you should ask for help yesterday because we want you to be as proactive as possible to minimize any potential burden for you. So you should ask for help when you're having difficulty providing care. And that could be with transfers or even managing some of those behaviors that are associated with dementia. You should ask for help when you fear that you may get injured. The situation may start to become a bit more unpredictable or unsafe. Ask for help when you are unsure of how to respond. That can be what to say and or how to say it. Also ask for help when you find yourself frustrated, overwhelmed, anxious, or depressed. I can guarantee you that as a caregiver, you have probably experienced at least one of these emotions, and you may have struggled with finding the right supports. You should also ask for help if you find yourself constantly arguing with your loved one. So please understand that caregiver burnout is a real thing. And sometimes you essentially disconnect from who you are or who you are becoming because of some of the diagnoses and the conditions that we discussed earlier. So please remember, caregiving is a team sport, and we really are here to encourage you to build that village and to consider adding therapists to that team or to that village, because we truly want to ensure that you have the tools needed to be successful in this caregiving journey.